Totally kidding. All right, so then we'll do active range of motion. So go ahead and bring your arms up for me. And all the way back. Good. Out to the side, all the way up. Good. And slowly down. We're doing drop arms, Codman's drop arm test at this point, so you can just state that during a practical. Codman's negative. And you could do elbows out and elbows in for internal, external. You can also have them just rotate their arms in and out. That's fine. I've also seen students doing in and out. Those are all acceptable for internal and external rotation. So we'll extend your arms, great. Arms, fingers, hands up to the ceiling, over, hands up to the ceiling, good. Oh, hands, what am I doing with hands? Oh, ulnar deviation and radial deviation. And you can have them flex the hands at the MCP joint, and then they can make fists, and you're checking dips and pips this way. Fully extend the fingers, bring the hands down, open the fingers, and add back the fingers. Any questions on that? It's pretty quick. Then we'll do muscle tests. Some of you have learned to check the upper body by doing your deltoid test like this. That's totally acceptable. I will be doing it this way. That's also acceptable. And for the upper extremity, you can do both arms at the same time for efficiency, okay? So I want you to keep your hands in this position. I'm going to cause resistance against you. I just want you to hold that position, okay? Good. So adduction, biceps, triceps, good. Bring your hands up to the ceiling and hold. Extensors, again, flexors, good. Yeah, let's forget that one. So now I want you to move your hand, rotate it out to the side like this, and I'm going to resist your pressure, okay? Good. It's more like a that rotation. There you go, and hold here, and back in. So that's external and internal rotation. Well, same thing on the other side since we're doing it. Good. Internal. Good. Tired. Oh, we did flexors. So grip strength. Squeeze my fingers. 1, 2, 3. 1, 2, 3. One more time. 1, 2, 3. So 3 seconds, 3 times. And then keep your hands like this, and we're just going to test your adductors. Okay. I think so. Good. So then we'll start with the orthopedic tests themselves. Did you guys want me to turn him around and we'll repeat the muscle testing first? All right. So again,
when you're doing this little test, do we have to just perform it, or
you'll just perform it, and then you'll say
down.
active range of motion, you know, with the normal limits in the elbow, shoulder, wrist, digits of the upper extremity.
Okay.
Yeah.
And muscle strength is 5 out of 5.
5 out of 5, and with the normal limits. She'll have a list for you of all the pertinent negatives. So just hold this position. Again, see, again. Good. Up, hold. Hold. Good. Bring your wrists up to the ceiling. Hold. Flip them over, same thing. Hold. Good. I always forget that one. So again, I would explain how to rotate the arm outward. Just I'm going to press against you. Very good. You can hold out here. And I'll press against you to try to bring that in. Yeah, right. You're so strong. Again, he was like throwing me out of the room earlier. Okay. Not grip strength. Hold my fingers. 3 seconds. 2, 3. One more time. 1, 2, 3. 1, 2, 3. Good. And hands apart. Hold them here. And you're not pressing very hard. These muscles aren't that strong, so you can really easily clench the fingers. Sorry about the sun in your eyes. And that's that. Any questions on active muscle testing? It goes pretty quick. It's pretty straightforward. All right. So then we'll start with orthopedic tests. You can do Apley's test first. So bring your hand to your shoulder and up behind your head to the other shoulder. Good. And around back to the shoulder. Make sure you come back and check where his hand is on the shoulder, so we can compare. And on the other side, up behind your head to the other shoulder. Good. And behind your back to the other shoulder. And again, compare. Excellent. I can do the AC shear test, or acromioclavicular shear test from here. So you want to follow the clavicle to the acromioclavicular joint. The heel of one hand will go on that joint. The heel of the other hand will go on the spine of the scapula. You're going to cup the shoulder with both hands, and your hands don't cross, but. And you're just going to press the heel of your hands toward each other. You're looking for extra give to the joint, crepitus, pain. There could be slight movement of the AC joint itself. That would be positive, otherwise it's negative. We'll do shoulder apprehension. Put your here. You're going to press forward on the scapula anteriorly. And I want to come around and just make sure he's not, wincing, essentially. Speeds test. So you want the arm 45 degrees and the hand supinated. You can palpate the bicipital tendon while you press down. Good. Yergeson, so keep your hand at your side. Again, that outward movement. I'm going to resist you while you do that. Good. Lippmann's, so I'm just going to support your arm. Just relax. I'm going to palpate the bicipital tendon while you internally and externally rotate the arm. Okay. Empty can test, so hands at your side. Adducted, or internally rotated 30 degrees. You can rest your hand on the shoulder, but you're not necessarily palpating the supraspinatus. And resist my pressure. Good. And then we'll come around and do varus and valgus for the elbow. So I like to put my hands right on either side of the joint. I have more stability that way. Some of you may have been taught to do it at the wrist. You can do it either way. So varus is pressing the upper part of the extremity. Laterally and the forearm medially, we're testing the lateral collateral ligament. Valgus is the opposite, and we're testing the medial collateral ligament. You can go ahead and do Cosen's. Bring it up and hold. You should feel, if it's positive, pain at the lateral epicondyle. You can also palpate, but you don't have to for that to be positive. Golfers, likewise, up to the ceiling, resist my pressure. If you feel pain in the medial epicondyle, you can also palpate that area as well. Down the hands, so Tinel's sign. Take your hammer and you'll tap on the median nerve. Any pain, tingling, numbness in the first 3.5 fingers would be positive. Phalanx, go ahead and squeeze your hands together for how long?
30 seconds.
60. So we won't wait during the actual practical for you to do that for 60 seconds. You would just state that. That'd be great. And then Finkelstein, so make a fist, put them in. You can either have them push the hands towards the floor or out to the side. Positive would be pain in the head of the radial head, in that area for de Quervain's tenosynovitis. There's Elman's compression. If you could go ahead and lie down, please. You want the shoulders to be square. And I'm going to have you rotate your arm in and out like this once I start pressing on your shoulder, okay? So you're just going to press straight down toward the ground and have him rotate. This pushes the humeral head into the glenoid cavity. We're checking for crepitus or pain. That would be indicative of arthritis. Okay.
What was that called? Sorry.
Elman's compression rotation test. Any questions? Should we flip over and repeat some of those and you're not able to see some of those?
No, that's fine.
You sure? Okay. Questions? All right. We'll move on to spine. Stand up for me. Again, as always, you just start observing your patient, looking for intelligent position, anything unusual, any deformity, any swelling anywhere. Observe his posture from the side. Consider kyphosis and lordosis. You can come behind, check the hips, check the shoulders and the ears just to make sure they're all in line. And you can do gait analysis. So if you could just go ahead and walk across for me. Good. Just observing from head to toe. You can also do heel to toe. So if you could walk on your heels for me. Sorry. This checks what nerve? L.
3.
4. All right. So the os anterior. Toe walking checks what nerve? L5. Down top. And then we can do the other toe as well. Together walking. Good. Again, if anything's tender in the neck or in the back, please palpate it first. And if your patient's in pain or they seem to have any kind of uncoordination or imbalance, for the range of motion exercises, stay close and always just have your hand near them if you might fall. So we'll start with the neck. Go ahead and bring your chin to your chest. Chin all the way up to the ceiling. Good. Over one shoulder. Over the other shoulder. Good. Ear to the shoulder. Excellent. Go ahead and touch your toes to the floor. Toes to the floor, that's pretty easy.